How to perform a sterile dressing change. When preparing to do a sterile dressing change, the nurse first must wash her hands, check the physician's orders, and then clean the overhead table with a sanitation wipe. The nurse then washes her hands, collects her supplies, and enters the patient's room. After placing her supplies on the overbed table, the nurse will introduce herself to the patient, ask the patient for their two forms of identification, which are their name and their date of birth. The nurse will assess for any allergies to latex or tape, and the nurse will explain the procedure to the patient. After raising the bed to a working height or your waist level, the nurse will move the garbage can with her foot only to the side of the bed and open and place the red biohazard bag at the foot of the patient's bed. The nurse will lower the patient's side rail, wash her hands, and apply clean gloves in order to remove the old dressing one layer at a time, being careful not to pull out any drains or staples. The nurse will lift up the patient's gown in order to have full access to the dressing. She will carefully remove the old dressing one layer at a time, being careful not to cause the patient any pain or discomfort. After removing the dressing, the nurse will assess the drainage for the amount, color, odor, and consistency, after which she will dispose of the dressing in the red biohazard bag. After, the nurse will assess the wound for irrita. She will assess for redness, edema, ecchymosis, drainage, and approximation. She will note any form of dehiscence or if the wound is intact. After, she will remove her gloves and wash her hands. Before opening the sterile wound cleaning kit, the nurse will ensure that the package is not expired and has not been opened. She will then open the package away from her and pinch out the sterile drape, holding it only by the 1-inch border, and place it on the overbed table. The nurse will now move her kit onto the sterile field. She will note that the area in which she placed the kit is no longer sterile. Since the area in which the kit was placed is no longer sterile, the nurse can apply her sterile gloves. When preparing to don sterile gloves, the nurse must pick up the first glove at the opening of the inside, tucking her fingers and thumbs together and pulling the glove over the hand, not allowing the hand to drop below the waist level while donning or after the glove is on. When donning her second sterile glove, the nurse can take her sterile gloved hand, placing her fingers underneath the cuff of the second sterile glove, and slide the glove over the second hand. Once they're both on, she's able to adjust accordingly. With sterile gloves on, the nurse is now able to remove the ABD pad, the 4x4 gauze, and the sterile saline solution. The nurse should note and inspect that the seal hasn't been broken, that it hasn't expired, and that the solution is clear, not cloudy, without any precipitant. The nurse may open the bottle and place the opening of the cap facing up to the table to avoid contaminating the cap. To clean the wound, the nurse will begin at the suture line, cleaning from top to bottom with one stroke and then dropping into the biohazard bag. For the second sponge, the nurse will reach around to the furthest edge and clean with one stroke from top to bottom. And finally, with the third sponge, she will clean at the edge closest to her in the same way from top to bottom. After, the nurse will place 2 4x4 gauze onto the patient's wound and place the ABD pad over the gauze with the blue strip facing the sky. After, the nurse will remove her sterile gloves and wash her hands. Finally, the nurse will take the tape and place it over the patient's wound dressing to secure it. She will write her initials, the date, and the time, and she will doggy ear the edge of the tape for the next nurse. Before leaving the room, the nurse will cover the patient up, raise the side rail, lower the bed height to the lowest position, place the call bell within the patient's reach, and dispose of her supplies. After, she will wash her hands and document the dressing on drainage, appearance of the wound, how the wound was cleaned, and what type of dressing was applied, and how the patient tolerated the procedure. She will also document ARETA, again for the area, the redness, ecchymosis, edema, drainage, and approximation, and noting if the wound has dehisced.